So acute GvHD is a serious complication of allogeneic stem cell transplantation, resulting really in significant morbidity and also transplantation-related mortality. And ATG and post-transplant cyclophosphamide PTCy are the main methods of in vivo T cell, or rather lymphodepletion in allogeneic stem cell transplantation. They are mostly used in matched or mismatched unrelated donor transplantations, but also in haploidentical stem cell transplantations. And there is no head-to-head prospective comparison between ATG and PTCy. There was this large registry study of the EBMT that didn't show any differences in outcomes of transplantation between the two, but a detailed non-registry comparison in patients undergoing matched unrelated donor transplantation with reduced intensity conditioning was lacking. So we therefore set out to compare transplantation outcomes of matched unrelated donor transplantations with reduced intensity conditioning using either ATG or PTCy. And for this, we used the data of two recently merged academic centers in Amsterdam. They have merged into Amsterdam UMC, where I work, and one center was using ATG and the other was using PTCy. And so we compared these two populations, which were otherwise identical and you were receiving the same treatment and the same supportive care. And we saw that grade 2 to 4 acute GvHD was significantly higher in the ATG group with 46% compared to PTCy, which was 23%. And when we look to grade 3 to 4 more serious GvHD, the difference was even more pronounced, with 20% in the ATG group compared to only 4% in the PTCy group. We didn't see any differences in chronic GvHD, and also relapse rates were comparable between the groups. Non-relapse mortality and overall survival seemed to be better in the PTCy group, but these differences were statistically not significant. And interestingly, there was another study at this EBMT meeting presented by Dr. Givel from Poland, which also showed more favorable results for the PTCy conditioning in the patients with acute lymphatic leukemia. However, in this study, the rate of acute GvHD was comparable between these two modalities of lymphodepletion, though in this study they saw improved relapse and non-relapse mortality rates in the PTCy group. So PTCy seemed to be more superior with less non-relapse mortality and also less relapses. So in conclusion, we do need more prospective studies to show whether PTCy is really superior to ATG.